Carmel Hauck. My student number is T00702793. This is my clinic mentor BK or Brenda, and this is Juniper, who is our canine patient today. So we're going to start with our anatomical features. So starting with the ear, we have the pinna, which is the external portion that we can see from the outside. It's kind of the funnel portion that lets sound go into the inner ear. The external auditory canal, we have the vertical external auditory canal, which is the outer portion, and then the inner portion, which is the horizontal canal. So it's kind of an L shape in her ear. And then we have the tympanic membrane, which is also her eardrum. So that is the thin connective tissue down towards the inner canal as well. So that is between the external auditory canal and the middle ear. And that's the portion that vibrates when sound is introduced to it. For her eye, we have the cornea, which is that thin transparent membrane or the protective layer that coats the outside of her eye and lets light enter the eye. So the cornea, if we look at her from the outside, that's what kind of makes her eyeball a bulb, so the portion that kind of concaves out. And then we have the iris, which is the colored part of the eye. So she has blue eyes, so the blue portion of her eye is the iris, and that is the portion that lets the light into the eye. And then we have the pupil. So the pupil is the opening in the center of her iris, and it enlarges and shrinks when light is exposed. And then we have the sclera. So when she looks off to the side, we see the white part of her eye is the sclera, and we can see that there are blood vessels there as well, and that just kind of helps to support the eye. For her features around the eye, we have her upper and lower eyelid. So she has her upper eyelid and her lower eyelid. And then we have the medial and lateral canthi as well. So her medial canthus and her lateral canthus. And then on her other eye, medial canthus, lateral canthus. And that is where the eyelids kind of come together in the corners. And then we have lacrimal puncta. So this is the part of the tear draining system. So again, it's near the medial canthus, and they are two small openings. So she has a lacrimal punctum on the upper and the lower eyelid on both eyes on the medial corners. And this is where the tears drain from the surface of her eye. Next is conjunctiva. So that is the thin membrane that covers the eyeball. She has the bulbar conjunctiva, which covers the rostral part of the eyeball. And then there is the palpebral conjunctiva, which covers the portion, that lines the eyelids. Next is the nictitating membrane. So this is also the third eyelid. So it kind of is also located medially, and then it extends out laterally on both eyes. And the last one we have is the nasolacrimal duct. So these are her tear ducts. They are located medially again, and they start at the lacrimal punctum. So the tears flow down two small ducts into the lacrimal sacs, and then further into the nasolacrimal ducts into the nasal cavity as well.